Good afternoon, everyone. It's Dr. McQuillan from Berkshire Menopause Clinic. So I'm doing a 3-part series on endometriosis. It is very complex and it is very individualized, and it's really important that we understand about the process, about what the symptoms are, so we can recognize and get people the treatment early. And then, of course, really individualized care, but the management really depends on your particular circumstance. So in this first part, I'm going to be talking in particular about what is endometriosis, how it presents, and how we can diagnose it. So let's get started. So if I just take my model for now and just talk about what is endometriosis. So endometrium, that is the womb lining. Endometriosis is where there is womb lining-like deposits in other areas of the body. So this could be anywhere in the little layers in the womb itself, and often people will be told that they may have something called adenomyosis. So this is where there is endometriosis-like deposits within the layers of the womb causing adenomyosis. You may also get deposits on the ovaries. That is very common, little endometrial deposits. Also, you may get endometriosis cysts. Their other term is called chocolate cysts, again around the ovary. Then some people get endometriosis further away. So not only can you get it in anywhere in the womb, in the ovaries, anywhere in the gynecological organs. So you could also get area little deposits on the cervix, in the vagina, and also then in the pelvis. So around the womb itself, so lots of fluid that can be found in the pelvis, and also around other organs that are in the pelvis, for example, near your bowel, near your bladder. And for some people, endometriosis can go as far as traveling to the lungs. So it is found in pretty much anywhere in the body, and is very difficult to diagnose for that reason. So let's talk about why it happens. So some of the risk factors could be you have a family history. So for example, I often see patients in clinic who say, my sister had it, my other sister had it, my mum had endometriosis. So it may be that that's quite common. Having a low BMI, so a low weight, can be a risk factor, and having autoimmune conditions. So it is often thought of as an inflammatory condition. So if you're already suffering from other inflammatory conditions, you may be more prone to this as well. Anything that increases your exposure to estrogen can cause endometriosis or be a risk factor for endometriosis. So this is, for example, having no pregnancies, having early periods, having late menopause, and having short cycles. Why is that? Because we know that endometriosis tends to be triggered by estrogen. So when we think about how endometriosis presents, and I'm going to talk a little about it in a little bit, but what happens is it starts off predominantly around your cycles. So because your womb lining, when the estrogen increases, then eventually we shed our womb lining. What happens with these other deposits in the other areas? Because they're like your womb lining, your endometrium. So again, when estrogen increases, they flare up and then they shed the lining. So it could be anywhere in the body, they shed. Now you might not even know about it because of the fact that when your womb lining sheds, normally it comes through the cervix and the vagina and then out as a period. Whereas obviously if you've got these other deposits in other areas of the body, they're bleeding and you may not know about it other than how you present with different symptoms. And we'll come to that in a minute. Some of the other things that can occur or be a risk factor is what we call retrograde menstrual flow. So that means that the flow of your period, instead of going that way, goes that way. One example of where that can happen is if you've got an obstruction. So for example, the way your womb shape is, you may have a large polyp or a fibroid that stops the period coming out, and then the period flows backwards into the pelvic cavity. So that can be a risk factor as well. Some of the causes could be, as I've said, retrograde menstruation, but some of the other theories are things like cell changes, and having an immune condition as well can be some of the causes. So how does endometriosis present? So I've just said to you, it's your womb lining shedding, and it's deposits that are like your womb lining in other areas of the body. So the first thing people commonly say is that they get very heavy period flow, so lots and lots of bleeding during their cycle. The other thing is they get very painful periods, and this may be painful in the womb itself. Also, it can present where pain is in other areas of the bodies, where other areas are bleeding and shedding. You may then get chronic pain. So I've said to you that it tends to be triggered by estrogen, and that's why around your period these gets worse. But why do people get chronic pain? Well, the reason is because when these areas bleed, eventually when you get chronic bleeding, chronic over time, again and again trauma to those areas, then you get inflammation and scar tissue. And those things are more permanent. They don't tend to just be cyclical, which is why patients then start to present with chronic pain over time that isn't just around their period time. You may get other symptoms such as having bowel symptoms, so you may get blood in your stools. You may get IBS-like symptoms, so going to the toilet more diarrhea. You may get constipation. You may get spasms in your bottom if there's deposits around the rectum or the anus. You may also get blood in your urine, where it presents like you're having urine infections, so pain or painful bladder. So you can see why these can be mistaken for other symptoms as well. Some people also get severe pain running down their legs. So you may think it may be shooting pain. It just may be this chronic ache that you get due to the nerve pains in the pelvis that then refer down your legs as well. You may get deposits in scar tissue, so other areas of scar tissue, and so the scar becomes more painful at times as well. And then you may get twisting pain. Again, it could be anywhere in the pelvis, some twisting pain where there's cysts on the ovaries may become large, so you get large ovarian pain or twisting pain again that you have to watch out for. And of course, let's not forget fertility. So often people will present because they're trying to get pregnant, didn't even know they had endometriosis till they had investigations and that was found. So that is a bit of a run through about endometriosis and how it presents and what are the risks of it. What are the investigations? Well, I always say keep a symptom diary because it is so important, because everyone is so individual how your symptoms present. They may be cyclical, they may not be, but having that diary can really help. And in terms of keep a diary of what your bleeding's like, how heavy it is, what the pain's like, where the pain is, what other symptoms there are, and what things might help you or what things might make it worse as well. That's the first way. So often, clinically, you can just diagnose by talking to someone. Investigation-wise, so examining people. When you examine someone, sometimes you can see little deposits on the cervix. But the other thing, just examining someone, they may get pain in their pelvis. You may be able to feel a large ovarian cyst. You may feel that the womb isn't really moving because eventually scar tissue has formed as well. So it's important to do that. Some people on an ultrasound, you may be able to see, again, large ovarian cysts. You may be able to see fluid in the back of the pelvis as well. You may be able to see that the womb doesn't move much. You may be able to see that the ovaries are quite stuck to the womb. So again, these are just non-specific, but signs that can be that there is endometriosis. There may be other scans like having an MRI scan that can again show more detail. And then of course there is having an operation or a laparoscopy, which is a keyhole surgery to have a look. Now, what I always say to patients, it's really important. The laparoscopy is always thought of as the gold standard for investigation, but you may not even see on a laparoscopy endometriosis. And the other thing to be aware of, as I've said to you, that scar tissue over time and inflammation could be a real problem for patients. And let's not forget, having any operations or having any investigations that are invasive can further scar tissue and inflammation. So it's really important we have a careful discussion with you about whether or not investigation is actually needed in the first instance, or actually whether we trial some treatments, and if that works, and that the investigations aren't, for example, for fertility, actually could weigh up the risks of having the operation be more than actually the benefit. And could you just have more benefit from treating it, knowing that that probably is the diagnosis? So I hope that was quite a detailed run through, but I hope that helped. The next part, we're going to talk about how we treat endometriosis.